Hello and welcome to this edition of Time with Hime. Superintendent Hime.
Glad to be here.
Hey.
Fast moving. We're about to start.
This week we have a lot of action going on. Our families are well aware. We have device pickup. We have meet and greet. We have
just enrollment. I mean, it's kind of check in because, it's new. Schedule pickups. We have a lot of students who are virtual, and that's going to be different. They're trying to figure out their schedule. We're trying to get teachers to start making contact. So if you're elementary, you should be hearing from your teacher. If not today, tomorrow. Device pickup has been, it's new. I hear it's going really good. 3 through 12, the Chromebooks are going out pretty smoothly. The iPads are a little slower because they have to be touched. The techs have to mirror those each device with the student, so it's a little slower process. And we do have some people that they're catching a break in work or whatever, so they're trying to run up there and get it done, which is fine. But best you can stick to your appointments on those things.
That's right, and be patient. It's a big delivery of technology that we're working through, and we want to do the best we can to serve your students.
Yeah, the number of virtual students we have is really high, so we have a large number. So we're checking out more devices than we expected when we started this process. So yeah, just have patience, but we'll get them out. We'll get you a device, and hopefully everything will be ready to go Monday, and we'll be full-fledged ahead.
What's the one thing you want our families to know? We've gotten a lot of questions, and most of them have been about the device pickup and what about schedules. So what do you want to share with them as they watch today?
Just remember Friday's meet and greet. Hopefully when you get to your building and you get to see your building, you get to see the teachers your student will be working with, you get to see your principal, we'll get that sense of security, and we'll get answers to any questions we may have. The phones still work, email still works, everything's still going. So don't keep contacting us. That communication line, this podcast has been a lot of fun. I've enjoyed doing it. I feel like there's a lot of people watching it. We've got out some good information. But most of the questions we're answering are questions, things, and people are asking us. And we've redone a lot of things based upon parent requests and thoughts we're getting from the public. So, again, it matters what people are saying and asking.
We have a big delivery. Usually we're giving them out, but we're getting something from the state this week.
Yep, we're supposed to be getting the governor bought some PPE, basically some shield, some face mask, and some gloves and different things for us to use, and we're supposed to pick those up on Thursday.
Is there anything you can tell them about when they're going to find out about their teacher as far as the virtual?
The virtual should be getting that information just anytime, different ages, different groups, different times. Obviously, we had to take the numbers, assign teachers. We've assigned the teachers. The schedules are being put out, and teachers should start contacting them, the parents and the students, to let them know what their schedule are, who their go-to teacher is, getting email addresses, and start those open lines of communication.
And we have teachers back in the building this week.
Yes, teachers back working. And again, as we'll tell you, we are working very hard. It's not the norm. The norm is the first thing everyone's got to think about, and we just have to get better at it, is safety first.
What is it that we need families to do for us as the school year begins and things that they hear?
Well, we're going to hear lots of things. Just know we're working to stay safe. There's a huge change in we have to be more diligent, and if our kids don't feel good, keep them at home, and some of those things. Take their temperature before they go to school. We've talked about how big of a struggle that would be for us, but take their temperature before they go to school. Get them a mask. You're going to hear rumors. Make sure you're checking with your principal, your teacher, or your go-to virtual teacher. So that line of communication between us, the Lawton Public Schools, and you, the parent, is probably the most important thing we can have.
The thing I'm excited about today is we have a special guest, and I'm actually going to let you ride solo by yourself and take care of it.
Well, okay, let's go for it. Hey, we know it's edible.
Right.
Editable.
Okay. That's right. And so I know this is a shorter segment, but we want to bring in our special guest. So I am going to take a quick break, and we're going to bring in Brandie Combs, who has been a great partner to our school district, and share some information that will be helpful to you and to our district.
Hey, we're excited.
Okay. We'll be right back.
Welcome back. We are so excited today to have Brandie Combs, the director of the Comanche County Health Department. Before we get started, I want to tell people how lucky we are here at Lawton Public Schools. I have been on Zoom calls with superintendents across the state. I've talked to superintendents in other areas, and they talk about how they get different information from different people at their health department, how their health department's not working with them. here at Lawton, we are so lucky. To her and her staff, they are 100% our partners in this pandemic. And we have to be teammates. We need to all work to get through this together. And Lawton is so lucky to have her. So we're here. You're going to talk about keeping us safe and the things we can do, how the quarantine process may or may not work. So I'm going to be quiet, which everybody knows is hard for me to do, and we're going to give you some time.
Okay. Well, I appreciate the opportunity to come and talk to you, and certainly appreciate the comments about staff, because the health department staff have worked hard. They're exceptional, so thank you for that. So, I wish I had a playbook that we could put out here on the table and we could just go with it and know exactly what to do when it comes to COVID, but unfortunately, that's not the reality that we're dealing with. We are learning something new with COVID all the time, and now that schools are opening, we're even learning more as far as what the impact is going to look like. So the county health department, Comanche County Health Department, we put out numbers every day. People need to understand that while that's really the only piece of data that we can put out there for consumption, but it's certainly not the only piece of the pie. It's not the only picture that we need to look at. So when we see big increases in numbers, the initial thought is, oh my goodness, our county's getting worse. So what we try to do is couple that with, is it in a specific location? So for instance, is it contained in a DOC or a jail facility? Is it contained in a particular location that's not going to actually impact the entire community? So help us by, seeing the whole picture and not just the number. We have the alert map as well, and so that's another indicator that schools are using. But again, it's one piece of information to a much bigger picture. And so we are trying very hard to make sure that we have as much information pushed out to the community so that everyone can make decisions, whether it's a congregation or a school administrator or, a CEO of a business. What should we do based on our numbers? The number one thing, and you and Lynn talked about it, we need to social distance. We need to wear masks, and we need to make sure these kiddos are washing their hands, and we're washing our hands. And so school teachers, coaches, principals, administration, you do not have an easy job ahead of you, and certainly parents are going to play a huge role in that. If your kid is sick, we cannot encourage you, urge you, beg you enough to not send them to school. We really need them to stay home because we don't want an outbreak in a Lawton public school system or any school system. We've seen a lot of asymptomatic positive cases. So that means we have people who are testing positive who aren't showing symptoms. So if you have someone who tests positive and who feels relatively fine or maybe doesn't feel great but doesn't show a lot of symptoms, they may be tempted to not wear a face mask to school or not wear a face mask out in the community, not recognizing that they're putting others at risk by doing so. So the more we can stress hand washing, social distancing, face covering of some sort when you can't social distance, and stay home when you're sick.
And that's news for even like me and our adults because, I pride myself, I went 5 years in a row one time without missing a day of work. And I will tell you, I just don't miss work. And I've talked to my employees about it and the people I work around. If we feel bad, we've got to stay home. It's not a sign of weakness to stay home when you feel bad.
Right.
Another great thing that Brandie has told us that I told a group of superintendents I was on a conference call with the other day, this is not a cookie cutter. There are no cases alike. So if you hear this person got quarantined for this, but there are differences in the case, and that's one thing, you can talk a little bit about quarantine and kind of the case scenarios, but I want people to understand one thing, that the health department here does such a great job for us. First of all, I've made it clear to myself and other superintendents, we can't quarantine people. Right. We can tell them that we can encourage them not to come to school, but we can't tell them to stay home. That's the health department's job to isolate and quarantine people. So we're not telling students they can't participate in football. We're not telling teachers they can't come to work. That's coming from the health department. And that's where that partnership is so good in sharing information. But you might tell some of the teachers or parents the questions you're going to ask as you determine who you are going to quarantine.
Sure. So just for terminology sakes, we're quarantining contacts and we're isolating positive cases. So if someone tests positive, they will be isolated in their home. So we need them to stay home. And the time frame depends upon if they're symptomatic. So if they're symptomatic, they're going to have improvement of symptoms and no fever for 24 hours without fever-reducing medication after a 10-day isolation period. So if they're a contact to a positive case, that's different. So it'll be 14 days And then again, it depends on if some symptoms are involved. But we need people to cooperate with us. So when we call and ask for contacts, it's not a fun job. Our nurses and our staff who are working these cases, it is not a fun job. We do not want to shut down a football season. We do not want to cancel basketball games. We don't want to do this, but we have to work together to hopefully prevent that. One step to preventing the spread is making sure you social distance as much as you possibly can and wearing face masks. So when we do have a positive case, obviously that case is isolated, and then we try to identify who those contacts are. Within 6 feet is the CDC recommendation, so within 6 feet for more than 15 minutes. So your coaches have a tough job ahead of them. How do you have a football practice where the guys are not within 6 feet for more than 15 minutes? So there's some strategies, cohort your teams so that it's not free for all on the field where everyone is around each other, but you have a group of players who are together. Same thing we're saying in in the classroom, make sure you have a seating chart, make sure that that child sits in a particular seat all day long. And so then if that child ends up positive, we know who their direct contacts are. So opposed from quarantining the entire classroom, we can quarantine a few children. So all of those, and that's where it goes. One case is one case, and it's not going to translate to a second positive case because the circumstances are different. So the keys that we look for the time frame, 15 minutes or longer, within 6 feet of a positive case. And if that's the case, you're a direct contact, and we're going to ask you to isolate.
We talk about mask breaks. You talked about this in one meeting about how you recommend they take mask breaks and where they take them. That's kind of interesting for teachers to understand and parents how that'll look.
Sure. So we get it that, and what we provide to you, what CDC has provided, what the health department has provided, it's best practice, it's guidance, it's what our recommendations are. We know reality sets in, and we know you have to figure out how to make it work in your setting. So sure, can a child wear a mask for 8 hours and never take it off during school other than when they eat? That's probably going to get burdensome for them. So maybe you want to have a class outdoors. So go outside, because the more you can be outdoors, the risk lessens. So go outside, have a mask break, maybe playground. Keep your recesses down to less than 15 minutes because then they're not exposed to each other for that 15-minute time frame. And then figure out ways where you can keep the kids even on the playground. Some schools have talked about trying to, first for 5 minutes or 10 minutes, you get this section of the playground, and then the next 10 minutes you blow a whistle and the kids switch. Or be creative. I don't know. Again,
Social
there's
distance.
not a playbook for this.
Yes. And we've talked about it in seating charts. The common sense is, so we're all going to have a seating chart and we're going to do it alphabetical. Then you think, well, wait a minute, maybe we should have everybody sit by their friends. Because if I'm sitting by we never let anybody sit by their friends because they talk too much. Not when I was in school, no one did that, but they talk too much when they're by their friends. But they're already going to be close contact with that person most likely because they're their friends. They hang out at night. They socialize outside of school. So why put them in contact with other people? So those are some things that, like you've said, it'd be nice if you could just write down 10 things and say, here, if y'all do this, everybody's good.
That's right.
But it is new every day. And again, just to reiterate how lucky we are here at Lawton Public Schools to have your staff and your people. We've had nothing but great things from them and the contacts we've had. And I know they've got a tough job. There's not one person can imagine that quarantining a student who's going to miss the first week of their senior year or the first day of school their senior year or possibly their first football game or their first volleyball game. You guys lose sleep over that. There's no doubt. You guys are in a people business. You want to take care of people, and so we appreciate y'all. If there's one more thing you'd like people to just take away, our students, our families, our teachers, our staff, what would it be?
So I think, with public health, it's individual choice, and we rely so heavily upon the public to participate. And so there's plenty of controversy over what you should or shouldn't do, and everybody has an opinion. But what we know from this virus, we know that masks help reduce the spread. We know that washing hands help reduce the spread, and we know that social distancing works. So the more we can practice those three things, the better off we're going to be. You can still do everything right, and I get it. You may end up with a case in your classroom or in your school, but the more we can practice those prevention measures, the better off we're going to be. But you're right. You know, we get that there's college scholarships on the line. We know that these students want to be on the field or on the court. We get it. We want to work with our coaches. We want to work with the students. But at the end of the day, our job is to protect the public. And so we need those coaches and teachers to be, a partner with us, and they are, but to figure out how to do it in a safe way, how to bring these kids back in a safe way. And parents are just as big a part of that solution.
Yeah, and our job is to reduce that contact area. I really feel like when the health department, when we first make that contact, they start at zero. They don't start at the whole school and try to work back and try to reduce the number they want to quarantine. They start at zero. And our job is, if we can shrink our area of contact, that's the fewer people that if we come up positive who have to be quarantined. Again, wear a mask, stay social distance. Again, there was a military guy that I sat in on a town hall with. He said, treat everybody you don't know as if they're positive. Right. And if you treat everybody you don't know as if they're positive and you keep your distance, you lessen your chance and you help it. So thanks again for coming on. And again, I can't say it enough times how much we appreciate your staff and you for how you're going to help us, how you have helped us through these first few weeks of trying to get back to school. And we know it's going to get long and cumbersome, and there's going to be a lot of conversations, but it's a lot easier. Our jobs are not easy as administrators right now, but we appreciate your staff for making it easier. So thanks again for coming and stopping by, and we'll probably have you on. Hopefully this goes away and we don't have to have you on again, but we may have to invite you again to share some more information. So thanks again.
Yeah, and just quickly, if anyone has questions, there's lots of rumors out there, get on the Comanche County Facebook page and we'll accept questions and we'll answer them as well. So we'll hopefully help reduce the rumors.
Yeah, because like she's saying, that you work for everybody in the county, not just Lawton Public Schools.
Right, yeah.
We're bragging on what she does for us, but I know other school districts in the area will say the same thing, and other organizations. So thanks for coming and joining us, and we appreciate you.
Appreciate it. Thank you.